Chickenpox. Definition. Chickenpox, varicella, is a viral infection that causes an itchy, blister-like rash. Chickenpox is highly contagious to people who haven't had the disease nor been vaccinated against it. Before routine chickenpox vaccination, virtually all people had been infected by the time they reached adulthood, sometimes with serious complications. Today, the number of cases and hospitalizations is down dramatically. Symptoms. Chickenpox infection usually lasts about 5 to 10 days. The rash is the telltale indication of chickenpox. Other signs and symptoms, which may appear 1 to 2 days before the rash, include fever, loss of appetite, headache, tiredness and a general feeling of being unwell, malaise. Once the chickenpox rash appears, it goes through 3 phases. Raised pink or red bumps, papules, which break out over several days. Fluid-filled blisters, vesicles, forming from the raised bumps over about 1 day before breaking and leaking. Crusts and scabs, which cover the broken blisters and take several more days to heal. New bumps continue to appear for several days. As a result, you may have all 3 stages of the rash, bumps, blisters and scabbed lesions, at the same time on the 2nd day of the rash. Once infected, you can spread the virus for up to 48 hours before the rash appears, and you remain contagious until all spots crust over. The disease is generally mild in healthy children. In severe cases, the rash can spread to cover the entire body, and lesions may form in the throat, eyes and mucous membranes of the urethra, anus and vagina. New spots continue to appear for several days. When to see a doctor. If you suspect that you or your child has chickenpox, consult your doctor. He or she usually can diagnose chickenpox by examining the rash and by noting the presence of accompanying symptoms. Your doctor can also prescribe medications to lessen the severity of chickenpox and treat complications, if necessary. Be sure to call ahead for an appointment and mention you think you or your child has chickenpox, to avoid waiting and possibly infecting others in a waiting room. Also, be sure to let your doctor know if any of these complications occur. The rash spreads to one or both eyes. The rash gets very red, warm or tender, indicating a possible secondary bacterial skin infection. The rash is accompanied by dizziness, disorientation, rapid heartbeat, shortness of breath, tremors, loss of muscle coordination, worsening cough, vomiting, stiff neck or a fever higher than 103 F 39.4 C. Anyone in the household is immune deficient or younger than 6 months old. Complications. Chickenpox is normally a mild disease. But it can be serious and can lead to complications, especially in high-risk people. Complications include bacterial infections of the skin, soft tissues, bones, joints or bloodstream, sepsis, pneumonia, inflammation of the brain, encephalitis, toxic shock syndrome, Reye's syndrome for people who take aspirin during chickenpox. What you can do in the meantime. While you wait for your appointment, you may be able to reduce fever with ibuprofen, Advil, Motrin IB, others, and acetaminophen, Tylenol, others. Anyone recovering from chickenpox shouldn't take aspirin. This is because aspirin has been linked to Reye's syndrome, a rare but potentially life-threatening condition, in people recovering from chickenpox. Rest as much as possible, and avoid contact with others. Chickenpox is highly contagious until skin lesions have fully crusted. Tests and diagnosis. Doctors generally diagnose chickenpox based on the telltale rash. If there's any doubt about the diagnosis, chickenpox can be confirmed with laboratory tests, including blood tests or a culture of lesion samples. Treatments and drugs. In otherwise healthy children, chickenpox typically requires no medical treatment. Your doctor may prescribe an antihistamine to relieve itching. But for the most part, the disease is allowed to run its course. If you're at high risk of complications. For people who have a high risk of complications from chickenpox, doctors sometimes prescribe medications to shorten the duration of the infection and to help reduce the risk of complications. If you or your child falls into a high-risk group, your doctor may suggest an antiviral drug such as acyclovir, Zavirax, or another drug called immune globulin intravenous, IGIV. These medications may lessen the severity of the disease when given within 24 hours after the rash first appears. Other antiviral drugs, such as valacyclovir, Valtrex, and famciclovir, Famvir, also may lessen the severity of the disease, but they have been approved for use only in adults. In some cases, your doctor may recommend getting the chickenpox vaccine after exposure to the virus. This can prevent the disease or lessen its severity. Don't give anyone with chickenpox, child or adult, any medicine containing aspirin because this combination has been associated with a condition called Reye's syndrome. Thank you for watching video. Like and subscribe my channel.